Hi, a very good evening. So today's live session will have quick revision class from oral surgery. There is a reason why I've scheduled this live stream almost 1 hour prior. I had two options, either to conduct this live session at around 7:30 p.m. IST or to conduct the same at 10:30 or 11 p.m. IST. So I chose the former option because it's always better to do something early than late. In worst case scenarios, it's always better late than never. So, anyways, I'm really glad some of you could join me live. So, in today's live session, as I said, we'll focus on a few select topics from oral surgery. I hope you guys are all ready. So, before we proceed, we'll initiate with yesterday's context-based, case-based question, and then we'll jump into our quick revision class from oral surgery. So, very good evening once again. So, I've asked you a question in the comment section. So, how are you feeling? Most of you chose option A. I'm really glad to look into that because if you are feeling very good, it's definitely fantastic sign. If you have no idea how you're feeling, please contact me through mail. I'll guide you further. Okay. Yes, I hope everything is streaming fine. Yeah, audio, video streaming. I hope I can proceed. If you have any issues or if you want me to raise my voice, do let me know. I can do that accordingly. Yeah, hi, very good evening. So this picture is from 2018. So our first international, I think our second international tour when we visited South Korea. It was a surprise tour because we planned it as a surprise and we didn't have any expectation when we reached South Korea, Seoul, Busan, Jeju Island. And when we reached that place and when we've seen what's actually there, we were taken away by surprise. It's almost like Western culture in the sense. Look at if you look at all development, all the progress, you'll be amazed by the same speed trains, high-speed internet, and it's a place for Samsung and also Kia, right? So there are so many multinational companies, and it's an amazing place. Especially my favorite is Jeju Island and Busan, and this picture, which you can see, it's from Seoul. Onto the right side of the screen, you can see water body. So that's one of the largest rivers in South Korea, Han River. And on the left side, it's not so clear, but you can see a huge building, a tall skyscraper. That's a 63-story building. It's a 60-story building. It has significance. It's also called a 60 office or something. I'll give you some information. I mean, it's golden yellow in color, very beautiful to look at, and it faces this Han River. It's an amazing place, amazing climate, and you'll definitely enjoy, especially Jeju Island. It'll be a surprise for you for sure. And you'll see all modern cars, and especially Busan. You might have watched a movie Train to Busan. In fact, we took that train. Luckily, there were no zombies, and it's one of the fastest trains we have. Right after French TGV, we have fast trains, super fast trains available, connecting the South Korean places like Seoul to Busan, Busan to Seoul, etc. It's a wonderful place, and I would definitely recommend all of you to visit this place in your lifetime. So with this, let's proceed. Yeah, it's definitely it's definitely a wonderful place. Now let's move on to our case-based question. Yesterday's case-based question. So most of you have given several answers. So Dr. Tenku has mixed in these proportions. So which one would you pick to restore a cavity? So I think most of you chose option B. Why not option C, and why not option A? It's very obvious. Option A, that is the left image, it's very grainy and it doesn't have much strength, right? And extreme right, too much of liquid, mercury, again, compromise in the physical properties. But the central one, which is shiny but not too shiny, as that of the right image, is considered to be normal triturated mix. So the left one is under triturated mix, the central one is normal triturated, and the right one is over triturated. Yeah. So as you all have chosen yesterday, I really appreciate your enthusiasm. So appearance of freshly triturated amalgam mixture. A grainy under-triturated mixture, restoration made of such a mixture has low strength and poor resistance to corrosion. I mean, you can manage, but it'll be a compromise. So, and in the center, you can see a shiny mix. And the shininess is absent in case of image A, the left image. So B, a properly triturated amalgam that appears rounded with a smooth, shiny surface. Whereas C, the right image is over-triturated amalgam mixture, which is shinier than that of properly triturated one. And because of more fluid consistency, the mass appears flattened by force of trituration. You can see it's more flatter comparatively, right? Yeah. I hope it's clear. Wonderful, well answered. Now let's move on to our first question in oral surgery quick revision class, our eighth quick revision session. So the parameter which makes surgical extraction of impacted third molar difficult. So among the following, choose a parameter which makes surgical extraction of impacted third molar difficult. Option A, the size of the follicle, large follicle. Option B, wide periodontal ligament. Option C, separated from second molar. We're talking about third molar, separated from second molar. Option D, long, thin roots. So which one do you think is more appropriate answer? That is the parameter which makes surgical extraction of impacted third molar difficult. So we'll review some parameters which make surgical extraction of impacted third molar easy, and those which make surgical extraction of impacted third molar difficult. Try answering this question. In the meantime, let me review some literature, and also you can look into that table simultaneously. So factors which make surgical extraction of impacted third molar easier on top and difficult below. So you can see mesoangular position, class 1 ramus, class A depth, roots are formed 1/3, 2/3, fused conical roots, wider periodontal ligament, larger follicle, elastic bone, separated from second molar, separate from inferior ulnar nerve, soft tissue impaction. So these factors or parameters make surgical extraction of impacted third molar easier. And those which make it difficult, distangular, class 3 ramus, class 3 depth, long, thin roots, divergent curved roots, narrow periodontal ligament, thin follicle, dense inelastic bone, contact with second molar, close to inferior ulnar nerve, or canal, complete bone impaction. So this is just the opposite to that of the upper table, isn't it? So based on the information that's available here, as most of you have chosen, I think almost all of you have chosen option D, right? Long, thin roots is the right answer. Wonderful. So in these questions, for that matter, any question, make a habit of going through the entire question options at least twice. And before you mark the answer, at least make it consciously, okay, rather than just taking it for granted. You might consider that easy, or you might consider it very easy or difficult, depending upon your perception, but don't take it for granted. Be conscious, that is, be in the moment. Don't get lost elsewhere. In simple words, don't time travel. Second question, an image-based question. Let's see how many of you are going to answer it right. The flap outline in the given image is option A, nasolabial fold or nasolabial flap. Option B, Abbey-Estlander flap. Option C, buccal pad of fat. Option D, orolabial flap. So among this, which one do you think is more appropriate answer? You can see on the right side, we have an image, and you can see a blue marking, or the blue outline representing one specific flap. So which one do you think this flap represents? So based on anatomic location, even if you have no idea, if you use common sense, you can answer it correctly. So you can see the outline extending from almost from a nose, from the top of ala, and then it's extending till the commissure or the lip. So obviously, it has to be something related to nose and lips. Exactly. So try answering this question. In the meantime, let me review some information. I'm not going to answer this, but this particular flap is also called as melolabial, M-E-L-O, melolabial flap, which is used for reconstructing defects involving oral cavity and those involving the lower third of nose. The flap is supplied by angular artery, intraorbital artery, infratrochlear artery, and can be based either superiorly or inferiorly. The area of recruitment for nasal reconstruction is in close proximity to the primary defect than is the forehead flap. So a disadvantage of this melolabial flap is that there is limited amount of tissue that's available. So I think most of you have answered it right. So option A, nasolabial flap, also called as melolabial flap. I have a question now related to this. Can nasolabial or milolabial flap be used as interpolation flap? Yes or no? Try to find out the answer for this question, and you can let me know the answer in the next session. Can this nasolabial flap be used as interpolation flap? Okay. So the same represented separately in a separate slide. So this is nasolabial or milolabial flap. Good. Option A is right answer. Now let's move on to the next question. Distraction osteogenesis, various steps matching based on the same. So on one column, you can see latency, distraction, consolidation, remodeling. There is various steps or stages in distraction osteogenesis and their corresponding explanations. So 1, gradual traction is applied. 2, maturation and cauterization of the regenerate. 3, application of full functional loading to the completion of regenerate bone modeling. And 4, bone division to the onset of traction. So match the following based on your understanding of distraction osteogenesis. Interpolation. 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 Yes, Davika, find out what interpolation flap means, and can milolabial or nasolabial flap be used as interpolation flap? Anyways, try finding out. We'll discuss. We'll start our next session with this particular question. Okay. So distraction osteogenesis, as most of you are aware of, in simple terms, you're distracting to promote osteogenesis of bone formation. So distraction osteogenesis is a tissue engineering method and can be integrated with various craniomaxillofacial surgical techniques to generate new bone via stretching the surgically osteomatized bone with the aid of mechanical device that is devised to control or designed to control both the traction rate and the movement vector. So this technique utilizes the fundamental healing properties of human body by inducing regeneration and remodeling of callus between osteotomized site, also known as distraction gap. The callus that is formed between the distraction gap will be stretched with the aid of distraction device to apply uniform traction force, thus allowing formation of new bone. And this distraction osteogenesis does not only cause creation of new bone, but also stimulates a process called neohistogenesis. Very, very important. And this neohistogenesis is where the surrounding soft tissue simultaneously expands and covers the newly formed callus, as you can see in this particular illustration. So we have various stages in distraction osteogenesis. In fact, in one of the literatures, they have mentioned about 5 sequential periods. First, that is osteotomy. And then second, there is latency. That is the duration from bone division to onset of traction, which is called as latent period or latency. And third, distraction. That is the time when gradual traction is applied and distraction regenerate is formed. And fourth, that is consolidation, where the period that allows maturation and corticalization of regenerate after traction forces are discontinued. That is consolidation. And finally, remodeling, which extends from the initial application of full loading, functional loading, to the completion of regenerate bone remodeling. So this is basic steps and basic understanding of distraction osteogenesis. So based on this, try answering as many as you can. So based on the literature review, latency, A, as you can see, 4. A goes with 4. Bone division to onset of traction. From bone division to onset of traction. Distraction, so distraction you can see be one gradual traction that is applied, which is nothing but you're trying to distract or pull the segments. And then consolidation. So consolidation will go with maturation and corticalization of regenerate, that is 2. That is C goes with 2. And finally, D, remodeling, goes with 3. Remodeling is application of full functional loading to the completion of regenerate bone remodeling. Okay. So these are some of the steps in distraction osteogenesis, and this is an illustration for your better understanding. Okay. So starting with osteotomy, and then latency, distraction, consolidation, and remodeling. So 5 sequential steps in distraction osteogenesis. So even if you're not able to answer it right, don't worry. At least try to understand the sequence, and you can make a note of this particular question or the options in a sequence. Okay. Yeah. I know these kind of questions are time consuming. If you're not clear about answering these questions, leave them for solving in second phase. Okay. Now, let's move on to our next question. I'm sure almost every one of you is going to answer this right. How long one should wait before obtaining biopsy of an oral ulcer? You come across an oral ulcer, you don't go for biopsy for all cases. If at all you're planning to go for a biopsy, how long should you wait? 4 days, 7 days, 14 days, 30 days. So which one do you think is a more appropriate answer? So first of all, oral ulcers, they heal very fast, very quickly because of tremendous vasculature within the oral cavity. And we should wait for a specified amount of time before we go for biopsy, which you're going to answer now. So biopsy is also indicated. It has specific indications like pigmented lesions, either black or brown. When tissue is associated with paresthesia, this is considered as ominous sign, right? And if a lesion suddenly enlarges, obviously we go for a biopsy. We have a suspicion that it could be a tumor. So among the following options, which one do you think is more appropriate answer? Yes, it's 2 weeks or 14 days. So usually almost all ulcers which are found by trauma heal within 1 to 2 weeks. Personal experience, I can tell you, within 1 to 2 weeks. Therefore, any ulcer that is present for 2 weeks or more should be biopsied, right? So option C is the right answer. Very good. If you're right, fantastic. If you're wrong, update your information and progress accordingly. You have nothing to worry about because learning, it doesn't end with an entrance. It doesn't end with answering a particular question. Okay, so as you can see here, oral ulcer being biopsied. So biopsy, you go for biopsy in specific instances like when there is discoloration or when there is paresthesia associated or when there is increase in size all of a sudden. Now let's review another question. Dead space in physiology in lungs? No, we're talking about dead space in surgical wounds. Dead space in surgical wounds is managed by which of the following techniques? Using drains, suturing all tissue planes, packing the wound, all of the above. So which one do you think is a more appropriate answer? Yeah, I think I projected the question for a few seconds. Now, if you want to know what's dead space first, let's look into the illustration. So as you can see, suturing is done on top and the bottom of this particular illustration, and in the middle you can see some space. So usually this space is filled with blood, hematoma formation. So dead space is an area that remains devoid of tissue after wound closure, as evident in this illustration. It's created by removing tissues in depths of wound or by not reapproximating all tissue planes during closure. These spaces are usually filled with blood, that is hematoma, which delays healing and predisposes to infection, right? So it's quite obvious. So how do you manage dead space? There are 4 ways of managing dead space in surgical wounds. So all of the above, as you all have been mentioning, is right answer. Suturing all tissue planes, pressure dressing, packing with antibacterial solution, and then use of drains, right? So these 4 ways are used for managing dead space in case of surgical wounds. Now let's review our case-based question for today. A patient who has a medical history significant for chronic renal failure is put on a regular diet. The next day, the patient develops flaccid muscles and decreased urine output. Remember, the patient has history of chronic renal failure. His magnesium levels are normal. Which electrolyte is the most likely cause for flaccid muscles and decreased urinary output? Calcium, sodium, potassium, iodine. You need not answer this question today. I want you to review literature regarding the same, and then you can get back in the next revision class with answer and relevant explanation, right? So the keywords here are patient's medical history, which is very significant. Chronic renal failure, he's put on a regular diet and he develops the symptoms. Clinical features, flaccid muscles and decreased urinary output. So given you some lab parameters, magnesium is normal, which means you can rule it out. Which of the following electrolytes is most likely cause of flaccid muscles and decreased urinary output? So search in this area, search in these lines, I'm sure you'll find the answer. Calcium, sodium, potassium, and iodine. Okay? Right, so let's conclude our quick revision class, and I'll see you again in the next quick revision class where we'll discuss the next subject accordingly, right? I hope this session is useful. Also, we have reviewed one image-based question. So in every quick revision class, we'll make sure that we're going through at least one image-based and one case-based question, along with general concepts which are relevant and important entrance point of view. Any feedback is always welcome. And you have any further queries, you need any further clarification, you can always get back through mail 24/7 at proudtobedentist@gmail.com, right? So as I keep on reminding, see, this motivation, daily dose of motivation is as important or equally important to that of daily bathing. I'm sure most of you bathe daily. So just like that, daily dose of motivation is also very essential. And that's the main objective behind conducting these quick revision classes, along with providing you some important relevant points and entrance perspective. I hope the objectives of sessions are being met. And as I said, if you need any further assistance, I'm just a mail away. So just focus on what you have to do now and give your best each and every moment. Don't worry about result or output at all, right? So wish you all the best. Love you all. Keep smiling. This is the beginning day of the week. So start with renewed enthusiasm. I hope you took a break yesterday. Start with renewed enthusiasm. Take periodic breaks. Take care of your food and sleep. Rest will happen naturally, right? Successful results will come based on the actions which you implement today, that is now. So focus on that now. Rest of the things will eventually follow. Okay? Not by some random chance, but purely by choice. Your choice. Okay, guys. Right. I'll see you again in the next revision class. Again, tomorrow I'll be out of town, but still I'll try to manage and incorporate this session. I'll let you know the timings. Mostly it's 8:30 p.m. IST, but if at all there are any changes in the timings, I'll let you know accordingly. Okay. So please keep a tab on the updates group, Google or Telegram. And those who are not part of our updates group, I suggest you to join the same. It's for free. You can just drop a mail at proudtobedentist@gmail.com. We'll provide you the link of the updates group where we'll be posting several updates relevant to your entrance. Okay. Oh, Danish, you passed your final year. Hearty congratulations and all the best for your post-graduation, PG preparation, post-graduation, and rest of your professional career. Congratulations. Yeah, you're welcome, guys. Good night. Take care.